Gentlemen, let me ask you something. What if I told you that something as simple as rubbing oil on two specific spots before bed could actually make a real difference in how things perform in the bedroom? I know. It sounds like one of those doctors hate this one trick, gimmicks you see all over the internet. But hear me out, because what I'm about to share with you is backed by both centuries of traditional use and modern biological science. I'm Dr. Lila Romano, a board-certified urologist with over a decade of experience helping men restore their vitality. And today, we're diving into something most medical professionals won't even mention: how a simple oil massage, done in the right way and in the right places, can improve blood flow, ease tension, and yes, support stronger, more natural erections while you sleep. Now, before you click away thinking this is some kind of alternative medicine nonsense, stay with me. Because once you understand the science behind why this works, it'll make perfect sense. And I promise you, by the end of this video, you'll have a simple 5-minute routine that could change everything. But first, let's talk about what's actually happening inside your body. Because here's the truth that nobody really explains to men. As we age, a lot changes under the surface. Testosterone naturally drops about 1% per year after the age of 30. And by 50? That adds up to a significant decline. Your blood vessels start to stiffen like old rubber bands that have lost their elasticity. Your prostate gradually enlarges. And all the sitting, the stress, the weight gain, the poor sleep from those nightly bathroom trips, it all compounds over time. So when you wake up one day and things just don't fire like they used to, it's not your imagination. I see this in my practice every single week. Men who feel frustrated, confused, maybe even a little embarrassed. They wonder if this is just what getting older means. They worry about what it's doing to their confidence, their relationships, their sense of themselves as men. But here's what I need you to understand. Erections are not just about testosterone. They depend on 3 core factors: blood flow, pelvic floor muscle tone, and nerve sensitivity. That's it. And here's the great news. Every single one of those can be improved at any age. But the problem is, most men think their only options are either a prescription pill or resignation, just accepting that this is how life is now. But in reality, there's this vast middle ground filled with natural, effective techniques that most doctors simply don't have time to discuss in a 15-minute appointment. And one of the most powerful techniques in that middle ground is this oil massage routine I'm about to teach you. Now, let's talk about why oil actually matters here. Because when you hear oil massage, you might think it's just about lubrication. But that's only a small part of the story. Here's what most men don't realize. As we age, the skin and tissues in the pelvic area become drier and more sensitive. Every time you sit, walk, or move throughout the day, there's tiny friction happening down there. This creates low-grade inflammation that you don't even feel until it starts affecting performance. Think about it. Your pelvic region is one of the most used, most compressed, and least cared for areas of your entire body. You sit on it for hours. It's constantly under pressure. And yet, most men never do anything to maintain tissue health in this area. Using the right oil helps in 2 major ways. First, it acts as a protective barrier, reducing that microirritation that builds up over time. Second, and this is the important part, certain oils can actually absorb through the skin and influence the tissues underneath. They increase local circulation, reduce inflammation, and help relax those tight pelvic muscles that restrict blood flow. Here's a simple way to think about it. When you massage a tight shoulder, it feels looser afterward, right? The muscle relaxes, blood flows better, tension releases. Same exact concept here, but we're focusing on the blood vessels and muscles that directly control erections. And there's another piece to this puzzle. When blood vessels are relaxed and inflammation is reduced, your body can produce more nitric oxide in that area. Nitric oxide is the molecule that signals your blood vessels to dilate and allow blood to flow in. It's literally the mechanism behind how erections work. More relaxation, less inflammation, better nitric oxide production, stronger blood flow. Now, here's why doing this at night is absolutely critical. Your body does most of its repair work while you sleep. Tissue regeneration, hormone production, muscle recovery, it all happens during those deep sleep hours. By doing this massage right before bed, you're taking advantage of your body's natural healing window. You're priming the system to repair, restore, and rejuvenate overnight. So, which oil should you actually use? Because not all oils are created equal, and this matters more than you might think. The oil I recommend most is castor oil. I know, it's a strange one. Most people only know castor oil as that thick, old-fashioned remedy their grandmother used. But this substance has been used in medicine for thousands of years, and modern science is finally catching up to explain why it works so well. The key component in castor oil is something called ricinoleic acid, which makes up about 90% of the oil. This compound is special because of its deep tissue penetration and potent anti-inflammatory properties. It doesn't just sit on top of your skin. It actually absorbs into the underlying tissues where it can boost circulation and reduce swelling. Castor oil also supports the lymphatic system, which is your body's cleanup crew. It helps clear out congestion and fluid buildup. This is especially important for men who feel heaviness or tightness in the pelvic area or who deal with prostate discomfort. Now, if you can't tolerate castor oil or find it too thick, there are good alternatives. Coconut oil is antibacterial, soothing, and absorbs easily into the skin. Almond oil is another solid choice because it's packed with vitamin E, which helps repair skin and connective tissue. But honestly, for improving blood flow and reducing inflammation in this area, castor oil remains the top performer. Here's what to look for when you buy it. Make sure the label says cold-pressed and organic. Avoid anything that says refined or has added fragrances. And definitely stay away from mineral oil or any petroleum-based products. Those can actually clog pores and irritate sensitive tissue, which is the opposite of what we want. Now let's talk about technique, because where and how you apply this oil matters tremendously. There are two critical spots you want to focus on, and most men have never thought about either of them. The first spot is your lower abdomen, right above the base of your penis. I'm talking about that area between your belly button and your pubic bone. This region covers the major blood vessels that supply the entire pelvic area, as well as the root of your pelvic floor muscles. Massaging here boosts blood flow directly to where it's needed most. It's like opening up the highway that leads to your destination. The second spot, and this is the one most men completely overlook, is the perineum. That's the small area between your scrotum and your anus. Now, I know that might sound uncomfortable to think about. Most men have never even considered touching this area intentionally. But stay with me here, because this zone is incredibly important for your sexual health. The perineum is directly linked to your prostate, your pelvic floor muscles, and the arteries that feed blood into the penis. When you gently massage oil into this area, you can ease prostate congestion, improve circulation to the erectile tissues, and help those deep pelvic muscles finally relax. Think of it this way. If the lower abdomen is the highway, the perineum is the on-ramp. You need both working properly for traffic to flow smoothly. Many men carry chronic tension in this area without even realizing it. Years of sitting, stress, and neglect create tightness that restricts blood flow. This simple massage helps release that tension and restore proper circulation. All right, let me walk you through exactly how to do this properly. This is the step-by-step protocol I want you to follow. First, start by warming about a teaspoon of castor oil between your palms. Rub your hands together for 15 to 20 seconds until the oil feels warm to the touch. Trust me on this. Cold oil in that area is never a pleasant experience. Taking this extra moment makes the whole routine much more comfortable. You can do this either lying in bed or standing comfortably in the bathroom. Whatever feels most natural and relaxed for you. The key is that you're not rushed and you can focus on what you're doing. Begin with your lower abdomen. Place your warmed, oiled hands on that area right above your pubic bone. Use light circular motions, moving slowly in clockwise circles. Apply enough pressure to feel warmth spreading through the area, but not so much that it's uncomfortable. You're not trying to dig in or force anything. Think gentle but intentional. Do this for about 60 seconds, keeping your breathing slow and relaxed. Now move to the perineum. Use your middle and ring fingers together, as this gives you the right amount of surface area and control. Apply the oil with gentle pressure, using small circular motions or slow back and forth movements. Again, you're not digging in. The pressure should feel firm but relaxing, like a good massage. Continue this for about 2 to 3 minutes. Throughout this process, focus on breathing slowly and deeply. This isn't just relaxation advice. Deep breathing actually enhances blood flow to the pelvic area and helps your muscles release tension more effectively. The whole routine should take about 5 minutes total. That's it. 5 minutes before bed. Here's how you know it's working. Many men notice a subtle warming sensation in the pelvic area during or after the massage. Others feel a sense of deep relaxation, almost like tension they didn't know they were holding finally releases. Both of these are positive signs that blood flow is improving and muscles are letting go. Now, you might be wondering, why specifically before bed? Can't I just do this anytime? So here's the science. Between 10 p.m. and 2 a.m. is when your body produces the highest levels of testosterone and growth hormone. These are the hormones responsible for repair, recovery, and yes, sexual function. Your blood pressure also naturally drops during deep sleep, which allows circulation to improve throughout your body, including to the pelvic region. So by doing this massage right before sleeping, you're literally priming your body to maximize its overnight restoration process. You're giving it the tools it needs: better circulation, relaxed muscles, reduced inflammation, right when it's most ready to use them. Most men who do this consistently report stronger, more consistent morning erections within just a couple of weeks. And that's significant because morning erections are your body's natural way of telling you that the system is working properly. When those come back stronger, it's a sign that blood flow and hormone function are improving. Your body is essentially saying, hey, we're back online. So how often should you do this? You don't need to go overboard. More isn't always better here. I recommend starting with 3 nights per week. Pick consistent days like Monday, Wednesday, and Friday. Do this faithfully for 1 month, then assess how your body responds. Some men find they do great with just twice a week after that initial month. Others prefer every other night. Listen to your body and adjust based on what you notice. If you experience any skin irritation, reduce the frequency or try a different oil. The key word here is consistency. This isn't a one-time miracle cure. It's more like working out. You don't go to the gym once and expect to be fit. You get results through regular, sustained effort. The same principle applies here. To help you remember, tie this routine to an existing nightly habit. Maybe you do it right after brushing your teeth or right before you get into bed. Keep your oil bottle somewhere visible, like your nightstand or bathroom counter. If you're forgetful at first, set a phone reminder for the first few weeks until it becomes automatic. And here's a bonus tip that makes a real difference. Before you start, place your oil bottle in a cup of hot water for a minute or 2. Warm oil feels significantly better, helps the muscles relax faster, and makes the whole experience more pleasant. This small step dramatically improves the effectiveness of the routine. Now, before you rush to try this, let me share some common mistakes I see men make with this technique. Avoiding these will save you frustration and help you get better results faster. Mistake number 1, using too much pressure. Remember, this is not deep tissue work. You're not trying to break up muscle knots. The pressure should be firm but relaxing, enough to feel warmth and gentle stimulation, but never pain or discomfort. If you're grimacing, you're pressing too hard. Mistake number 2, using the wrong oils. Stay away from mineral oil, baby oil, or anything with added fragrances or chemicals. These can irritate sensitive skin and actually cause more inflammation rather than reducing it. Stick with pure, organic, cold-pressed oils only. Mistake number 3, inconsistency. This is the biggest one. Many men try this for a few nights, don't see immediate dramatic results, and give up. But that's like doing 3 workouts and wondering why you don't have a six-pack yet. The benefits build over time with regular practice. Commit to the full 30 days before you judge whether it's working. Mistake number 4, expecting overnight miracles. This is not Viagra. You won't suddenly perform like you're 18 again after 1 session. This is gradual improvement through better blood flow, reduced inflammation, and enhanced hormone function. Think of it as building a foundation, not flipping a switch. Mistake number 5, skipping the warm-up. Applying cold oil too. This sensitive area is uncomfortable and can actually cause muscles to tense up rather than relax. Always warm the oil between your hands first, or warm the bottle in hot water. Now, a few important words of caution, because your safety always comes first. This technique is meant to enhance and support your health, not replace proper medical care. If you're experiencing severe erectile dysfunction, chest pain during physical activity, or any other concerning symptoms, please see your doctor. These could be signs of underlying cardiovascular issues that need professional attention. If you're on blood thinners like warfarin or aspirin, or if you have any bleeding disorder, be extra gentle with this technique or skip it altogether. The increased circulation is generally beneficial, but it's not worth any risk if you have these conditions. Hygiene matters. Always wash your hands thoroughly before and after. Keep your oil bottle clean and never share it with anyone else. And if you ever notice any lumps, persistent pain, or unusual changes in the area, stop immediately and get checked by your doctor. Managing expectations is also important. This routine supports your body's natural function. It helps optimize what's already there, but it works best as part of an overall healthy lifestyle, not as a magic solution that compensates for poor sleep, no exercise, and a terrible diet. Let me give you a realistic timeline of what to expect, so you know what you're looking for. During the first week, don't expect fireworks. Your body is just getting used to the routine. You might notice slightly better sleep or a subtle sense of relaxation in the pelvic area. That's a good sign, but the big changes come later. By weeks 2 and 3, this is when most men start noticing real differences. Stronger morning erections are often the first sign. You might also notice improved sensation, better blood flow during arousal, and a general feeling of less tension down there. After a full month of consistent practice, the improvements become more significant. Better overall performance, increased confidence, and often improvements in prostate symptoms like urinary flow and nighttime bathroom trips. The key is patience combined with consistency. Give your body the full 30 days before you evaluate results. This is gradual improvement through better blood flow, relaxation, and hormone balance. You're rebuilding functions that may have declined over years or even decades. That doesn't reverse overnight, but it absolutely can reverse with time and consistency. And here's something exciting. The benefits don't stop at the bedroom. Many men who practice this routine consistently report improved prostate health and better urinary flow. They find themselves waking up fewer times during the night to use the bathroom, which means deeper, more restorative sleep. Others notice reduced lower back tension, which makes sense because the pelvic muscles connect directly to the spine. When those muscles relax, it takes pressure off the entire lower back system. Better blood flow and muscle tone in this area even helps your workouts, especially core exercises. Everything in your lower body works together as a connected system. And let's not underestimate the psychological boost. When you know your body is functioning at its best, you carry yourself differently. You walk with more confidence, stand a little taller, and project a quiet strength that affects every area of your life. That shift might be invisible to others, but you'll feel it. So, gentlemen, here's my challenge for you. Give this a real try for 30 days. Pick up some organic, cold-pressed castor oil today. Commit to 3 nights a week. And observe how your body responds, your energy, your mood, your sleep, and especially those morning signs of vitality. I'm willing to bet that by the end of the month, you'll feel a difference you won't want to give up. And if not, you've spent a few dollars and gained valuable insight into how your body responds. Either way, you win. If you found this helpful, and if you know someone who could benefit from this information, share it with them. Sometimes the best gift is knowledge that can actually change someone's life. This is Dr. Lila Romano, and I'll see you in the next video.